Imagine what it's like to try and breathe underwater. This is what someone with cystic fibrosis feels like every day. Hi, my name is Whitney Murray, and today I'm going to tell you a little bit about what cystic fibrosis feels like and what someone with cystic fibrosis faces every day. We're going to talk about what cystic fibrosis is, what it affects, how it's diagnosed, how it's treated, and what a normal day for a child with cystic fibrosis is like. So what is cystic fibrosis? CF is a disease that affects the secretory glands of your body, specifically the ones that secrete mucus and sweat. Mucus is what keeps the linings of your organs moist. It prevents infections and keeps it from drying out. Normal mucus is slippery and wet, but a person with CF, their mucus is thick and sticky. It builds up in the organs, and it makes it difficult to breathe and easy for infections to start. It also makes your sweat very salty, and when you sweat, you lose large amounts of salt, which causes electrolyte imbalances. So what causes cystic fibrosis? It's a defect in the CFTR gene. This gene is responsible for creating a protein that moves salt in and out of the cells of your body. The defect causes the protein not to work right, and this affects your mucus and sweat. Everyone is born with 2 CFTR genes, one from each parent. If a child has 2 defective CFTR genes, then they do have cystic fibrosis. If they have 1 defect gene and 1 gene that is normal, then this means that they're a carrier for cystic fibrosis. This is a chart showing the breakdown that a father and a mother who are both carriers of cystic fibrosis have a 1 in 4 chance of having a child born with the disease. So who is at risk? There is approximately 30,000 cases of cystic fibrosis in the U.S. alone, with about 1,000 new cases being diagnosed every year. It affects men and women equally. It affects Caucasians and Northern Europeans more, but anyone can have it. There is approximately 12 million people who are carriers for this disease, and most of them don't even realize that they are carriers. And it is an inherited disease. So what are some signs and symptoms? Salty skin, frequent coughing, diarrhea with foul, greasy smelling stools or constipation, pancreatitis, diabetes, gallstones, dehydration, infertility, and frequent infections such as sinusitis, bronchitis, and pneumonia. This chart shows what it affects: sinuses, lungs, skin, liver, pancreas, intestines, and your reproductive organs. And this shows a normal airway. It's open. This shows the airway of someone with cystic fibrosis. You can see the mucus build up, and the green stuff represents bacterial infections. So it affects the respiratory system, but how? CF causes thick, sticky mucus to build up in the airways, which makes it easy for bacteria to grow. These bacteria causes infections, which causes increased coughing as the body tries to get rid of that mucus. Many of these infections that present are resistant to your basic antibiotics, so you have to be treated with more advanced antibiotics. The people with CF have recurrent sinus infections, bronchitis, and pneumonia, and they're at a greater risk of having a pneumothorax, which is a collapsed lung which has to be treated with a chest tube. How does it affect the digestive system? The mucus blocks the ducts in the pancreas and does not allow the enzymes to get through. These enzymes are what's responsible for the reabsorption of fat and protein back into your body. So when these enzymes don't work right, the fat is expelled in fatty, greasy stools. The mucus also blocks nutrients from being absorbed, which results in poor weight gain and growth in children with CF. The pancreas can also become inflamed, and this is called pancreatitis. Some other effects: the large amount of salt loss when sweating can cause dehydration. CF can cause clubbing of the fingers, which is the widening and flattening of the tips of your fingers, and this is caused because you're not getting enough oxygen to your fingertips. Low bone density can occur, and this can put you at risk for osteoporosis later in life. The men are usually sterile, and the women, although they can have children, they have a difficulty because of the mucus buildup in their reproductive organs. So what are some ways to diagnose? Well, parents usually realize it first because they realize that their child's skin tastes salty. At this point, the doctor can perform what's called a sweat test, where he will test the salt content of a small portion of your skin. 2 positive results in the sweat test mean that a child does have cystic fibrosis. Newborns are also screened for a defective CFTR gene, and they're also checked to make sure their pancreas is working properly. They can do chest x-rays to know any inflammation or scarring in the lungs, and they can also do pulmonary function tests, which tests to make sure your lungs are functioning properly and that you're getting enough oxygen to all areas of your body. You can also have a test done to see if you are a cystic fibrosis carrier. This is a normal chest x-ray versus an x-ray with someone with cystic fibrosis. You can see the infiltrates and the buildup in the lungs over here. So how is cystic fibrosis treated? Well, there is no cure. Treatment revolves around preventing lung infections, and if one occurs, treating it as quickly as possible, preventing any blockages in your intestines, and treating one as quickly as possible. You want to promote nutrition so they have a healthy growth. You want to prevent any dehydration. You can give medications such as anti-inflammatories, bronchodilators, antibiotics, and mucus thinners. And aerobic exercise is encouraged because it makes you breathe harder, which makes you cough up the mucus more. However, aerobic exercise, you have to be careful with it because it can cause you to sweat more, therefore you lose more salt, therefore you have electrolyte imbalances. Everyone with cystic fibrosis undergoes what's called chest physical therapy. It's also called chest clapping or chest percussion. It involves someone pounding on your back over your lung areas to make the mucus break up so you can cough it up. There are machines that can help with chest physical therapy, and there are some breathing devices that you can breathe into, which causes vibrations and loosens up the mucus. Chest physical therapy is uncomfortable, but it must be done to prevent mucus buildup. This is one of the machines. It wraps around your chest and pounds on it to break up the mucus, and this is showing that if they do it with their hands, you want to cup your hands instead of using a flat palm. So what's a normal day like for a child with cystic fibrosis? They must consume a large amount of high-calorie, high-fat foods to provide adequate nutrition. Breathing treatments and chest physical therapy occur every day, and most of the time several times a day. They must take a lot of pills, bronchodilators to help keep the airways open, enzymes to aid nutrition, antibiotics to prevent infections. A child can take anywhere from 10 to 30 pills a day. They also have frequent doctor's appointments and hospitalizations for medical care. So what's the life expectancy of someone with cystic fibrosis? Life expectancy has improved since medical technology has improved, and this chart shows that in 1950 the life expectancy was 2 years old. Now in 2008 the life expectancy was a little over 37 years. So life expectancy has increased a lot. In conclusion, we've talked about what cystic fibrosis is, what body systems it affects, specifically your respiratory system and your digestive system, how it's diagnosed, how it's treated, and what a normal day is like for a child with cystic fibrosis. And I hope that today I have taught you a little more about what cystic fibrosis is and what it's like to live with it. And I received all my information from the Cystic Fibrosis Foundation and MedicineNet.com. Thank you.